We know that the ketogenic diet is a powerful tool to fight obesity, pre-diabetes, insulin resistance, but is there more to it? There is research that shows that ketogenic diet is beneficial for your brain, your heart, and your lungs. And we will talk about that in this video.
Okay, so this study, which is pretty expensive, this is 3 out of 19 pages, but it goes into some pretty good depth how the ketogenic diet affects your brain, your heart, and your lungs. And so we want to kind of talk about that. And we've talked in the past how the ketogenic diet is good for your brain, but what exactly does that mean? Number one, enhanced cognition. We think better, we're more clear in our mind, and people will tell you that. Anybody who's been on the ketogenic diet notices that. We also have improved post-traumatic metabolism in the brain. So, and that's traumatic brain injury, right? We hear a lot about that with concussions and all that stuff going on today. So ketogenic diet, very good for that. Another thing that happens in the brain is increased phagocytosis.
Right.
So do you want to go into what?
Well, that's, so phagocyte, it means eating cell, right? Phago and cell.
A little Pac-Man.
It is. And there's a type of phagocyte that called a macrophage, which is a white blood cell. It's actually derived from a type of white blood cell called a monocyte. But white blood cells are our immune system cells. And so this isn't specific to the brain necessarily, but because immunity is on the brains of so many of us, this is an interesting finding, right? So that they found that the ketogenic diet increases the activity of these phagocytes, of these eating cells. Well, what are these cells eating when they are involved with the immune system? They're eating particles like viruses and bacteria. So, we're doing a little extrapolating here because this is a part on the brain, but if it is increasing the phagocytic activity, it does, make you think that it would give you some defense against infections that come into your body.
Right. And these macrophages, they don't just bump into stuff. I mean, they locate things and eat them.
Yeah, they're interesting to watch when they have,
Yeah, they go right to it.
It's kind of spooky.
Yeah, it's a little bit
to know
scary.
that's going on inside of us at every moment of the day.
It's a good thing, though.
Yeah.
Okay, so the heart. And we mentioned before that the ketones are good for your brain and your heart, but we've never really gone into a whole lot of discussion about the heart. So ketones actually improve the efficiency and substrate utilization of the heart muscle. So your heart doesn't have to work as hard. So that's a good thing.
Okay. Yeah. So and it will use any type of fuel that is available because the heart is so important to us. It's one of those organs in our bodies that can utilize any type of fuel that is available, whether it's free fatty acids or glucose or ketone bodies, or even like particles like lactate or pyruvate or things like that.
Yeah,
but ketones.
Ketones, and they can actually prevent or diminish damage from myocardial infarction, which is a heart attack. Let's just say heart attack. Makes it a little bit easier on me. Yeah. But because they don't require, all that oxygen and everything, there is a lot less damage when you have a heart attack. And so if you are in ketosis, you're on a ketogenic diet, you have a heart attack, you may have zero damage or, a very small or a smaller lesion, from that heart attack than, somebody on a typical diet would have.
Interesting.
Yeah, I thought it was very interesting. It also increases the number of mitochondria. So it makes and then again, that kind of goes to that efficiency. It makes your heart muscle much more efficient. Increases those little powerhouses that we have in the cells, the number of them.
Yeah.
But that brings us to the lungs. So we've never really talked about the lungs. It's kind of a boring thing, right? I guess we take our lungs for
not if you have a problem with your lungs.
That's true.
we take advantage of them.
We kind of just take them for granted, I think. This study goes into some of the things about the lungs, and so one of the things is that ketones diminish apoptosis in lung cells. Apoptosis is the death of a cell. Okay, and this is a study in shocked rodents. So they shock these rodents. It's not good to be a rodent if you're anywhere close to a lab. Yeah, but it prevented the cell death. From these these rodents in the study. They're also beneficial in cases of decreased oxygen.
Well, yeah, so that's actually when we first started really delving into the ketogenic diet, and I think one of the pioneers, at least in getting the ketogenic diet into the popular space, was Dom D'Agostino,
Right.
and still is, I'm
Right.
sure.
Yeah.
But his work at that time, at least what we were following him on, was his work with Navy SEALs. I think it was Navy SEALs, right?
Navy SEALs, Navy divers, yeah.
Yeah, making it better for them in conditions where there was low oxygen, as in when you're diving. And so he was looking at studying how ketones would make it easier for these divers to stay mentally alert when they were in low oxygen environments. And so, obviously then that translates into people that have lung problems with breathing.
Right. Yeah. So ketones actually decrease the respiratory exchange rate, and that's the rate of you're breathing in and taking the oxygen out and breathing out the carbon dioxide.
Right, and that's why and I've seen, as we were looking over some things for this video on there was clinical observations about patients with COPD. I don't know that there's been a whole lot of research on ketones and COPD specifically, but COPD, you have trouble breathing out. So one of the things that these ketones help with this exchange is that ketones are very clean burning fuel. So they don't produce as much carbon dioxide as, say, glucose when it's burned for energy. And so what these doctors that are treating patients with COPD are finding is that they are able to breathe easier, and the speculation is because there's not as much carbon dioxide that they have to breathe out of their bodies.
Right. So, right now we're dealing with this respiratory virus, worldwide, right? And like I said, we kind of take our lungs for granted. We do, as healthy people. But each year in the U.S., there's 50 to 60,000 deaths from the flu, mm-hmm. and that's just a typical, normal year. So if ketogenic diet can help that,
mm-hmm.
So.
Right.
From that, add in pneumonia, add in other respiratory, illnesses, along with some chronic ailments, like you said, COPD.
Right.
The ketogenic diet, just has so many things going for it. I think that, it's something worth noting,
Yeah.
In this day and age.
Yeah. Yeah, I think that's exactly right. And so, just another feather in the cap, I guess I would say, with the ketogenic diet. If you haven't gotten started with a very low carb diet or even a low carb diet, we have a list of 100 foods that will get you started. It's a really nice list. We'll leave links here for you. And that's about it. Thanks so much for watching, and we will catch you in the next video. Thanks.